My name is Julaine Smith, and this is a presentation for my workshop about the dangers of smoking and how it can lead to lung cancer. This first picture is depicting an image with a smoking sign which reads, "Stop smoking, your lungs will thank you." Let's describe what is cancer. Cancer is the uncontrolled growth of abnormal cells in the body. Cancer develops when the body's normal control mechanisms stop working. Old cells do not die, and instead growth out of control, forming new abnormal cells. These extra cells may form a mass of tissue called a tumor. So, what is lung cancer? Lung cancer is a type of cancer that begins in the lungs. The two main types of lung cancer are small cell lung cancer and non-small cell lung cancer. These categories refer to what the cancer cells looks like under a microscope. Non-cell cancer is more common than small cell cancer. The stages of cancer. Stages describe how far someone's cancer has spread. Small cell lung cancer is divided into two stages, limited and extensive. Limited means the cancer is confined to one lung and may be nearby lymph nodes. Extensive means the cancer has spread to other lungs or beyond. Non-small cell cancer is assigned a stage of 1 through 4, depending on how far it has spread. I have here another image which shows the stages of lung cancer. The first image is depicting healthy lungs. The second image is depicting early stage of cancer. And the third image is depicting late stage cancer. Lung cancer accounts for over a quarter of all cancer-related deaths and therefore established itself in the top spot as the leading cancer killer. Lung cancer is estimated to be the cause of nearly 1 in 5 deaths. That is 1.5 million deaths, or 19.4% of the total worldwide. But even though the majority of lung cancer cases are linked to smoking or exposure to tobacco smoke, many of the victims of lung cancer have never smoked or been exposed to a significant amount of secondhand smoke. Doctors believe smoking causes lung cancer by damaging the cells that line the lungs. When you inhale cigarette smoke, which is full of cancer-causing substances known as carcinogens, changes in the lung tissue begin almost immediately. Other causes are hereditary or due to the inhalation of radon gas, air pollution, or exposure to asbestos. Signs and symptoms of lung cancer. Lung cancer typically doesn't cause signs and symptoms in its early stages because the lung have tremendous reserve, and people with lung cancer may remain without symptoms for quite a long time. Signs and symptoms of lung cancer typically occur only when the disease is advanced, which include a new cough that doesn't go away, coughing up blood, even a small amount, shortness of breath, chest pain, hoarseness, losing weight without even trying, bone pain, and headache. This image is depicting the picture of Terry. She's a former smoker. Terry smoked her first cigarette at the age of 13. In 2000, she found a sore in her mouth that was diagnosed as oral cancer. Later, she found out she had throat cancer. In this video from CDC's Tips from Former Smoking campaign, Terry talks about getting home from the hospital after having surgery and her first realization that she had to quit smoking. She picked up a cigarette, put it in her mouth, and for the first time, in her own word, "I looked at myself in the mirror and I thought, Terry, what are you doing?" You can see more by clicking on her link above to see more about Terry's story. This image is showing a healthy lungs and also a lung that is filled with tumor. The frightening problem with this disease is the fact that I learned in school that the lungs have tremendous reserve, and people with lung cancer may remain without symptoms for quite a long time. When the disease starts to manifest, it may already be in an advanced stage. This is very sad, and early detection could save so many lives. Educating our youths on the dangers of smoking could make a difference in their decisions to start smoking or even to enroll in a program that will help them to stop smoking. This image is depicting early screening that could detect if a person has lung cancer. A degree of vigilance is expected on the part of physicians to suspect the diagnosis, especially in people who are at risk, such as chronic smokers. People suspected of having lung cancer are best investigated with a computer tomography CT scan of the chest with further diagnostic tests done based on what is shown on the images. These may include further imaging studies and biopsies. My workshop is to promote the Stop Smoking. According to Dr. Sunil G. Stevenson, he stated that with the recent smoking ban plus increased awareness of lung cancer screening, hopefully the next few years we'll see a decrease in the number of people smoking, and we will also be detecting lung cancer at an early stage. This will both reduce lung cancer incidence and mortality as we go forward. While we can't eliminate this disease, we certainly can control the greatest risk factor with more push to halt the smoking habit among our population. Stop smoking now.